Hello and welcome to Men's Health and My Perspective. My name is Larry Hamilton, and today I want to talk about my surgery, which was a robotic assist prostatectomy, where my prostate was removed due to a diagnosis of prostate cancer. I discussed my diagnosis and the decision to have the surgery in my prior episode. A few days before surgery, I had to have some blood work, I guess just to make sure everything was okay. Also, because of COVID-19, I had to have a COVID-19 test, which I guess that's now standard procedure. If you're going in the hospital for surgery, they're going to check you for COVID-19. It was not painful, but it was not pleasant. I now know how far back my right nostril goes. Uh, Brain tickler is an apt description. And thankfully, I did not come back positive for COVID-19, so the surgery went ahead. The day before surgery, I could have no solid food, only clear liquids. The morning of surgery, I could have my prescription medication and I could drink fluids up till about 8 a.m. I had to take a shower the night before, use a fresh towel with fresh bed linens in fresh pajamas. The next morning when I got up, I had to take another shower, again using a fresh towel and of course fresh clothes. The surgery was scheduled for noon, and we had to be there about 10 a.m. My oldest son drove me there and waited with me and stuck around till the surgery was over. We waited maybe half an hour, and then they took us back to a room that was the pre-surgery preparation room. The nurse there asked me all these different questions. I had to have a couple of drops of iodine in each nostril to help, I guess, sterilize things. I then had to use some sort of antiseptic liquid to brush out my mouth, brush my teeth, brush my tongue, brush my cheeks, and all around. And it was some little fake sponge thing instead of a toothbrush. Then the nurse left, and I had to take off all my clothes, and there was several of these special wipes. They had antiseptic material on them. I had to wipe down each arm, each leg, my torso and my back below the neck and avoid the groin. That was to, I guess, sterilize the area. Then I put on the wonderful backless gown. Another nurse came in, the pre surgery nurse, and she shaved the back of my right hand and put in an IV. Then the anesthesiologist showed up and she introduced herself and asked some questions about my general health and whatnot to make any final tweaks to the plan for general anesthesia. Then the urologist showed up. He's the surgeon, and he, you know, checked to see how I was doing. Said we seemed to be ahead of time. I asked to get a picture of my prostate after it was removed because I was curious what it looked like because otherwise I wasn't going to get a chance to see it. Then they wheeled me back to surgery. The anesthesiologist and her assistant were there, plus several others. It seemed like there was a dozen people there. There was probably half a dozen in there. The urologist was not there yet. They put an IV in my left hand as a backup because I guess since it's robot assist, with the robot, it doesn't leave a lot of room for them to get at me. So they wanted to have a backup line just in case they needed it. Then well, of course, they put me on the surgery bed first. Then they got the mask and started, said this is for oxygen and get out all the, minimize the amount of CO2 in your lungs. And I said, oh, just a minute, I want to say something because I was expecting everybody to be there before they knock me out, but I guess they knock you out before the surgeon comes back. And so I had this cool thing I wanted to say, and it didn't quite come out the way I wanted. And it was along the lines of, well, okay, well, you guys are doing your thing. I'm going to distract this stupid cancer, and then you go in and you sneak up on it and kill it. And it came out close to that. I think maybe the anesthesiologist probably thought I was high on anesthesia, but that was something I'd planned to say ahead of time because I wanted to be cool, inject some humor into the situation. The next thing I know, I'm waking up in the recovery room. The nurse is talking to me, and everything just seems a million miles away. It was total blackness, no dreaming, and I just could not, for the life of me, wake up. It's a lot like when I've had Benadryl. Benadryl is main ingredient is diphenhydramine, which is the main ingredient in most over-the-counter sleeping pills, and that stuff just knocks me for a loop. I felt like that, but even more so. And I guess I was having bladder spasms after surgery because the surgery removes the prostate and lifts up the muscles and does a reconstruction of the bladder because they change stuff in there. Of all things, he gave me a suppository to help calm down those spasms. That was really the only discomfort I recall right after surgery. After I guess I woke up a little bit more, they let my son come back, and he was disappointed. He was hoping I would be really loopy and saying all kinds of silly things, but I don't like to be out of control, so I wasn't saying a lot of silly things. After I got awake even more, they wheeled me back to my room. They stopped outside the door with the bed, and I was helped out of bed and basically hobbled over to the hospital bed. And it seems like that was about 7 o'clock or so. I got settled in and got my cell phone and took a picture of Mia in the bed and shared to social media to let everybody know I made it through surgery. Because, yeah, I was a little bit worried about surgery, but it's amazing. Waking up from surgery is a cure for one's existential dread of not waking up from surgery. So that went fine. I noticed that they shaved the lower half of my torso from about the bottom of my ribs to the top of my hips. So I've got this rectangle of bare skin. Well, now it's grown back quite a bit. And I was surprised they didn't shave the groin or anything, but I guess they didn't need to because they went in laparoscopically. I had ended up with 6 incisions. There's one in the top of my belly button. So if you're not looking at the right angle, you won't even see it. But I guess that's where they actually go in to take out the prostate through the umbilicus. Then there was this incision on the left side where the drain tube was. There's a drain tube that helps drain out the blood and other fluids that collect in the abdomen after surgery. It makes sense to me that they would do that. That reduces the amount of stuff the body has to process. It would also minimize chance of infection from it just sitting in there and probably blood clots. I didn't really feel too bad. I really expected to be uncomfortable from the catheter, and because they put it in when you're out, I didn't even know it was there. It only really bothered me if things tugged and it rubbed the wrong way on the tip of my penis. But other than that, it wasn't that bad. In some ways, I was more concerned about how I would feel with the catheter than I was with the surgery because I uh, had 10 days after surgery before I could get the catheter out because they wanted you to heal up a certain degree. And while not pleasant, it wasn't near as bad as I was afraid it was going to be. I was hopeful that not having to wake up in the middle of the night to go pee, that I'd sleep better, but in the hospital, I just don't sleep well. And I didn't sleep that much better once I finally got home. I was only supposed to be in the hospital overnight, and overnight, if things went well and I was holding food down, they'd let me go home. But unfortunately, the drain tube was still draining quite a large volume of stuff. So they decided to keep me till it stopped draining because they don't send you home with the drain tube. They want to be able to take it out. Then I guess some of my other blood numbers and stuff weren't great, and I wasn't. The problem with general anesthesia is it knocks out your entire body, even your bowels, and so those have to wake up. And mine didn't wake up fast enough, and I started throwing up what little food I'd had. And so they kept me another night. So instead of one night in the hospital, I had 3 nights in the hospital. But eventually things started working. I got to come home Monday afternoon. The shower I got to take before I got my clothes on to get ready for my son to show up and bring me home. That felt really good. I had to sit down because I didn't have a lot of strength, not having much solid food for a while. It really surprised me that they got us a wheelchair and just let my son wheel me out. They didn't have a nurse go with me. 28 years ago, I was in the hospital after a car accident and they wheeled me out to the car. So I don't know if that's because of COVID or what. That just kind of surprised me. But he parked the wheelchair and went and got my truck and came back. And I told him to be sure and put a step ladder in it because my truck is tall and I wasn't sure I could make the big step up. So I climbed up the step ladder. I had no problem getting in. So that was a very wise decision. I'm not sure getting into the car would have worked well because how low it is. That probably would have been more uncomfortable than getting into the truck. I did feel the bumps going home. That wasn't fun. I mean, it wasn't the worst, but I could feel things jiggle. As I said, there were 6 incisions. Those had some point tenderness, and generally my whole abdomen was swollen because they pump you up with air. A couple nights in the hospital, they told me that the air will travel up and you'll feel it in your shoulder. I felt it in my right shoulder, which I guess is the most common place to feel it, and it just felt like there was an ice pick in my shoulder. It was unreal. The joint just hurt, and it did it a couple times uh, after I got home. You just had to wait for it to pass because I guess I could have taken some pain meds for it, but anyway, it wasn't pleasant. The air working its way out of the system. I was able to, when I got home, use the stepladder to get out of the truck. That wasn't too bad. I didn't have any trouble going up the 3 steps to get in the house. I got to the recliner, sat down, was able to get in the recliner, get out of the recliner, get myself around to do my business. I was pretty weak, so I had my son fixing me food for the first day or two till I got where I had the energy to do it myself. And I did a lot of soup and crackers till things started working correctly. The first time that I had a sneeze or a cough or a laugh, of course, my abdomen hurt. The sneeze was worse than laughing or coughing, but it was not near as bad as the first time I sneezed after a car accident that I mentioned earlier I had 28 years ago. And it was a really bad accident, multiple rollovers. I do not recommend sleeping and driving at the same time. Don't do that. Pull over and don't do that. But I ended up with a T12 compression fracture, so I'm about a half inch or so shorter than I used to be because I used to be 6 feet tall. And the first sneeze after that, that was the worst pain from a sneeze I've ever had in my life. I guess that's good. However, we all have different pain thresholds. I think because of my experience with breaking my back and my collarbone and other things from that car accident, that I probably have a higher pain tolerance than I would otherwise. So that may be why I didn't think the recovering from the surgery was all that bad. I was pretty amazed as I was, once I got home, they sent me home with a prescription of a narcotic pain medication and a high power non narcotic pain medication. And I ended up only taking one of the narcotic pain pills and one of the non narcotic pain pills. And the rest of the time I got by with acetaminophen, which that really amazed me. And I really haven't had any pain medication for a couple weeks now, which, about 3 or 4 weeks, and then I really didn't feel like I needed it anymore. So that's my experience with the pain after surgery. The day I got home, my granddaughter and I walked around our block. That was pretty exhausting, but I did it. About halfway around the block, I realized I forgot my cell phone. I'm like, oh crap, I better not have any problems, or I'm going to have to send my granddaughter running home. But like I said, we were just going around our block, so it wasn't that far. And gradually, I worked my way up where I could do multiple laps, and now I'm back up to normal speed. Basically, my story about what the surgery was like, because they knocked me out, I really, there's nothing to remember. I mean, it went black. It's like being asleep but no dreams, at least for me. I woke up, Took a while to get where I could think straight and whatnot, but I was doing fine. And then my appetite slowly returned about a week after surgery. The family got sub sandwiches at the local sub shop, and I got a foot long sandwich thinking I'd get 2 meals out of it. And I ended up being so hungry, I ate the whole thing, which surprised me. And my appetite returned pretty fast. I guess my body needed that much food to recover. Took a while for the air in my abdomen to go down and get rid of the bloating. And it was a few weeks after surgery before I could wear regular pants. I had to wear stuff with elastic because of the pushing. I'll talk more about that in future. That's basically it with my surgery experience with a prostatectomy. Not as bad as I thought. Of course, once it's behind you, most experiences that you're worried about aren't so bad. Next week, I'm going to talk about the pathology report of what they found with my prostate when the pathologist got a hold of it, and talk about that on the next episode. Until then, I thank you very much for watching. I hope this has answered any questions you might have if you're facing some form of surgery, laparoscopic surgery, or more specifically, prostate removal. If you are a man over 50 or a man with a family history of prostate cancer, please, please, please make sure that when you do your annual physical that your blood work includes a PSA test. Because if you have a prostate, you need to keep an eye on it because it's very treatable. Certain forms of prostate cancer are less aggressive than and less filling of the prostate than mine was, and you may not need surgery. But if it is aggressive enough or filling the prostate like mine was, then you're going to want surgery. And the sooner you get it, the better, because if it gets outside the prostate, then things get more challenging for treatment. And my whole goal with this is to encourage men to take their health seriously so that they can be around for their family and friends and enjoy a long and happy life.